been now more than a year that we have organized this meeting, and so I'm very happy to be here because today is really the day. My name is Hanna. I come from Finvector. Finvector is located in Kuopio, few hundred kilometers north from Helsinki. We have there our TMP manufacturing facilities. Company's history is 20-15 years in mainly first, I was manufacturing, but my background is more in lenti production and that area, and recently also more on AAV. So because this is an education day, I would like to give some sort of an introduction to the bioprocesses overall. So I make a flowcharts, but they are pretty boring. So I was thinking that rather I would like to show you video which is not there. Or then I don't show you a video. I would have wanted you to see a video from our TMP, but because it's not there, we will go through the very boring flowchart then. So typically, when every manufacturing of the viral vectors is done in living cells, so we need a master cell bank or a working cell bank, and typically those are freezed in a small vial. So then we need to how we start the manufacturing. After we have done all the documentation ready, the facility is ready and released, and we have all the materials on place and handled under the TMP. When we can start the actual bio process is then the preparation of the buffers, of course. Most of the buffers are mainly required in downstream side, or if we are doing very large scale, quite often also the medias are prepared in-house, just because, well, it will be challenging to transport the water in the bottles to the side of the manufacturing. So when we start the production with all the vial of the cells, then we need to expand the cells. So it depends on then if we have a suspensor or adherent system, then typically some flask system is used at the beginning, and then it depends on if we are going to the suspension bioreactors or a flask type approach, or we can what do I can press or not like this. Then we go. We are here, so we go inoculate the cells into the bioreactor. And then we expand the cells more in the bioreactor, and then depending on the product what we have, if we have we do the infection. If you have a lenti, we do the transfection. If we produce, for example, AAV with the baculo, we typically do the transduction, or then we can induce if we have a stable cell line. We keep the cells alive by feeding them quite often. Perfusion is nowadays recommended. Then harvest of the product depends if you harvest the cells or if you harvest the media. There's different ways. And then the downstream is more a puzzle depending on also of your product. A typical downstream is microfiltration, where you clarify your cell debris, you do some pre-concentration and buffer exchange in TFF, anion exchange, purification, and then final formulation is typically done by TFF filtration and tensile flow filtration method. But all kind of combinations are there in use, and so it depends really on the product and your systems that you have available. Then I'm going through different systems. I'm not selling any of the examples here. They are just an examples. I'm not here telling which are better than the another one, because typically it is what you have used to use, what you have in house. So just an examples. But when we are going a very traditional way, we do sell growth and production in a flasks. Different kind of flasks. You can use roller bottles, different tea flasks. Nowadays, I think one of the interesting approach is to use hybrid stack from the Corning, which gives you a pretty good scalability if you still want to handle your cells only in an incubator. You don't have any bioreactor. For Lenti, I think cell factories, 10-layer cell factories are most commonly used. 10 layers you still can handle without that you need to employ any bodybuilders, but if you are using 20 layers, then you need some sort of a robot already to handle the system. But when we are working in this area, in flasks, they are available for everyone. We all know how to use those. They are pretty cheap, and good thing is also that when you have a small scale, you can see something. At least if you have one layer, you can put it under the microscope. However, it always requires handling. It's time consuming, it's not scalable. You just cannot handle too many flasks. Our traditional flask with triple layer D flask is 72 flasks, what you can fit to one incubator. So that's our largest flask type approach. You need to passage your cells. There's FPS typically present, but at some point you will face a problem, and it will virus, but I cannot scale. I cannot bring any more flasks to my process. And then also that you cannot control so much of your production. It's basically the same approach if you have a suspension cells in a flask. You can use roller bottles for the adjuvant culture, but also for the suspension. There is different shaker flask, different size, spinner flask with the barrel in the middle. You might need some motor to turn this to get the stirring, or then you can have just a magnetic stirrer. But I think the steps are pretty the same, except that when you are working already in suspension, you don't need to use any trypsin, so it's easier and probably faster than the passage your cells. You count your cells and you determine your viability. Adjuvant cells is that way easy because those that are attached, they are typically viable. And then these systems already require some mechanisms from your or some techniques to keep the stirring on because you need to shake the system. And then when you're shaking it somehow, it can cause some shear stress to your cells or to your product. One option to upscale the adjuvant production, if that is required, there is still some cells that just don't grow very well in suspension, and then there are some products that the productivity is just higher in an adjuvant system. So not always the suspension is possible for you. So then what are the options? And we had one product now in phase 2, and it has been done. And we noticed that its productivity was so much higher in adjuvant system than suspension system. So a couple of years ago, we faced the problem in challenging of the large-scale manufacturing. What can we do? And that's when we purchased the iCellix technology in-house. But there's also like FiberCell and Eppendorf is selling a packet bed bioreactor as a same approach type options. Here you can see fiber discs, and here is the picture of carriers from the iCellix system. Cells attached to the fibers, they go inside the fibers. So what is that giving us? It is scalable. It's efficient because 1 or 2 operators can handle now thousands of bottles if we compare that to culture area. It's disposable. Disposable comes when we go to GMP, we really don't want to do cleaning, or at least we don't want to do the cleaning validation. So everything that is disposable is an advance. It's controlled, and we can now get the perfusion working. When we have an adjuvant system, we still have FPS. Then my point here is the harvesting of the cells, that from this kind of systems you have problems to get cells out. So you can easily put cells in, you can easily grow them, you can easily get even your virus out, but you don't get easily your cells out. So if you harvest your product that is inside the cells, most probably you need to use some chemical lysis or autolysis just to release your virus to the media. But it's also a question, if you are using this high equipment, how you are really producing your cells to that equipment. So do you need to build up first a huge flask type approach that you can inoculate this system or no? So then I have one example. First of all, it's Pia Valonen is having a poster tomorrow where she goes through our this process. So I hope you have time to visit her poster. This is an example we did some months ago with iCELLis bioreactor. So it's also a challenge that we cannot sample the cells from the bioreactor because it's a totally closed system. So we need to understand the process better, most probably even than in suspension, because we don't see inside. We analyze the media and we try to understand by that what is happening there. We can see that when the culture starts, glucose curve is going down, and also dissolved oxygen is going down. So that's telling us that our cells have started to grow. Here we have done the infection, and we also increased the perfusion. And because the topic was a challenge, we, for example, in this run noticed that we had some foaming issues. We have an FPS in the media, so it's causing foaming. So these kind of things we need to optimize. I don't see that they are major problems. It just requires your optimization. And then when we did the infection, we increased the steering, we increased the perfusion. So that is why you can see the oxygen level going up for a moment, then coming down. And then what happens here is just that infection is ongoing there. Our observation was also from the iCELLis that there can be some uneven distribution of the cells in the bioreactor. It was actually not a very dramatic problem in large scale, but of course, saying that, I can also say that cell distribution is never perfect, not in a flasks either. If we have 3-layer flask, we have seen that you never actually get an equal homogenic growth in all layers. So it is there. We have, but we haven't seen any problems. Personally, I have not used microcarriers that much, so I'm probably the wrong person to tell you so much about the microcarriers. But one thing was that why we didn't choose microcarriers was this washing and preparation of the microcarriers, because when you start your process, you typically need to wet the microcarriers somehow, you need to sterilize. So this was the area that we wanted to avoid, and that is the reason we didn't took this route. But microcarriers have been on the market very long time. They are in commercial production for monoclonal antibodies, so they must be working pretty okay. Here you can see example of the microcarriers where the cells are growing on the surface of the carriers, but then there is also a new type of a microcarriers where the cells can go in the microcarriers, what then covers the cells, so most probably those cells are not so sensitive for the shears anymore. But then of course we come again to the problem, how can you get your cells out from that kind of a system. Microcarriers you are growing in the suspension stirred tanks. And always when we go to the bioreactor, advantages is that you have now a controlled system. And microcarriers you can sample also. Then if we are going to the suspension then, options, wave bioreactor or the cultivac, it's the same approach from Sartorius. We have, this is from our facility, this picture. We have been pretty happy with the cultivac system. It's easy to use, it's disposable, We have used this 20-liter bag where the culture volume is 10 liters. It's single use, it's controlled. For us at least, it has been pretty okay. I didn't find that much disadvantages from our use. One thing is that there's a perfusion only in a small scale. So this is actually may not be giving that much scalability. Because I have not used, and any of our collaborators have not used this 500-liter bioreactor, I don't know how the aeration is actually going. I have some doubts that if we go in a larger volumes, also there's more liquid. So I wonder if the aeration is really very good when we are going for the very high cell densities, when the requirements are high. But I don't know. I also could think how the heating system is really working in this kind of system, but it must be working instead. Typically, if we go to the suspension and we are looking for scalable processes, we are talking about different stirred tanks. And nowadays, we really are trying to find disposable systems where you have a different size of the bioreactor, and then you put disposable bag into the bioreactor, and that way you can avoid the cleaning issues. Again, it's disposable, it's single use, controlled. You can monitor and sample your cells. Problems might be, for example, shear forces, steering, and foaming. Foaming can be, for example, well, you know how the beer looks like when you have a lot of foam and it looks nice, but it really doesn't look nice if you have a bioreactor full of foam. It will be very, it will cause problems for your cells, and that's definitely something you want to avoid. You need to keep your cells in a very good shape, and viability needs to be good to be able to get a very high productivity. And if you have some foaming issues, you most probably your cells are suffering. And if your cells are suffering at some point of the production, I would even start over, because we have seen that if cells are suffering at some point, then you will most probably get a very low yield. Heating is also one question related to all large-scale equipments. How you can get fast enough and accurate enough heating. Is it electric-based heating or is it water-based heating? Water-based heating is still in use a lot, but then it means that you need to bring a water system in your facility. Is it open water system, which is it increasing a contamination risk on your facility or not? But those are the issues. Then before I have a couple of slides from the downstream, but overall the large-scale challenges, they are the same in upstream and downstream, and that will hit you finally when you are scaling up. This picture is telling the real issues. It's actually not even a very funny picture, because this is from Daily News last week from Botswana, where they have a really drinking water problems, but this gives you an idea what the large scale what kind of problems large scale will bring you. For them it is life and death. For us, well, we are developing medicine, but anyway, we want to have a large scale single use system, large volumes. It is bringing a new challenges for you. Then how do you handle the tanks? If we are having now in our facility 500-liter media and buffer tanks, so it's already quite heavy for the operators to work and push all the media. Or can you build a system that you don't need to push the tanks around your GMP facility? Can you rely on the pumping system? But this you need to be thinking when you are preparing and developing your process. And also that buffer and media preparation brings an own challenge now. You may not want to order thousands of liters of the media in the bottles. And then suddenly you realize that when you're going on a large scale, you need huge storage space for all the material required for the manufacturing. Materials itself and the human resources needs to be taken care of. As much as you can use automation easier, logistics will become an issue as well. And when we are talking about large scale, most typically we are then talking about phase 2, phase 3, maybe commercial production. Then the documentation, qualification, validation becomes more and more and more an issue and even a bottleneck, I would say. And then last but not least is the risks that when we are going to the very large scales, we don't want to lose the batch because it is already so expensive. But it also is, I can say, a biosafety risk. As a biosafety deputy, I can see that we can look this also from the safety perspective, that we are working with the biological material. Is there any increased risk for the humans or the environment? Then just some examples of the downstream. Centrifugation is the way we did it 10, 20, 30 years ago. It's easy. You can do gradient centrifugation to purify your product, which is actually pretty good. For example, for AAV, because you should be able to remove the empty capsid from the functional capsids. I could say that when you are doing centrifugation, there is less moving parts on the process development perspective. Then one option is a continuous centrifugation. If I say that centrifugation is not scalable, then some of you will say, well, there is scalable systems and continuous centrifugation can be a scalable option. So yeah, it is. Centrifugation is typically said that it is not scalable. Sometimes you need to collect by a needle, which I don't like. I also think that that's a safety aspect. And sometimes centrifugation is just time-consuming and requires handling. Microfiltration, ultrafiltration are the typical steps in the process. You use microfiltration in a clarification. You need to remove the cell debris before the actual downstream purification starts. You can use filtration to concentrate your product. If you need to do the buffer exchange before the chromatography, and typically, or it is scalable and pretty fast to do. The problems, you need to understand your product, you need to understand the system, shear forces. Is your product sensitive? Like lenti is much more sensitive than adeno. You don't want to destroy the lentivirus in the first filtration part. So then, what is your final recovery? Clocking of the system is one thing. You need to have a fast enough flow that you are flushing the membrane so that it's not clogging. But then you need to keep in mind that your transmembrane pressure and pressure for your product and flow is not too high so that your recoveries are high enough. So that makes already many things you need to optimize and you need to understand. And of course then you need to know what is the pore size and what is the matrix you are using that it is suitable for your product. And then at some point you may require very large buffers. Typical chromo step for viruses is anion exchange. There is size exclusion and affinity chromatography as well, but we are using, for example, a two-step anion exchange purification. I discussed of the chromo step and challenges with our chromatographic specialist Carmel Chenning, and I asked, what is your opinion of the disadvantages? And she said that there is no. She said that when it's working, it's perfect, it's fast, it's easy. And I'm an upstream person, so I said like, oh, there needs to be something that are challenging. She said, no, you just need to understand. So then we concluded that you need to understand your process, that when you finally have done it, you can say that it's easy, but you need to know your product, your pH, your charges, your buffers, your stability of your virus, what is the flow, and what is the capacity of your column you are using, this kind of. So for me, who is not so familiar very in details with the promo, I see that this is the part where so much things you need to optimize and you need to understand your product. But then, like Carmel said, it's scalable, it's fast, it's efficient, it's large capacity, and I know it very well, said Carmel. So this is, it says Outi. It's Outi Rautsis, sorry I have not mentioned. This is Outi Rautsis poster from tomorrow, poster 151. I hope you visit Outi's poster. She's describing our large-scale adenovirus purification. But just a case example that what we have done is now that when we do our harvest has been 107 liters at the moment, and we are using TFF to concentrate it to 20 liters and do the buffer exchange, and then the volume goes somewhere to 3 liters in a chroma and TFF two-step. Here you can see the recoveries, and final recovery in this process was 30%, what we are pretty satisfied, but we are still hoping that by optimizing we are able to increase this. And the purity of the product after iCellis upstream was very, very good. Many of these were under the detection limit, so we were happy. So, but second, the problems related to all the large scale, as I described, are one. But second take-home message I want before I let you go for lunch is then the analytics, that everything that process development team is doing, one very important perspective is analytics. How is our analytical assays good enough? Do they give us an answer? What do we need to know to understand the process? Do we have a potency assay that tells us that the product is to say, what if we start phase 1, we do some modification, phase 2, we are upscaling, phase 3, is the product safe? Is it comparable? Potency, expression, infectivity, empty particles, those we need to know in addition to all the impurities. So for process development team, the analytical persons are our best friends. But thank you very much.
I have a question. So you mentioned.
Speak up a bit. Is there a microphone? No, if not, just shout.
I can also.
It's over here, it's a problem.
Just a question related to the two platforms you mentioned, suspension and adherence for the upstream. Does it have an impact on your downstream, and what kind?
It can have, it always have. Whatever, even tiny little changes you do in upstream, it has an influence to the downstream. I actually like your question. Adherent systems, we typically have FPS, which is a huge issue, what we need to be removed for the downstream. But everything is also related to the product that you have. Do you need to collect your, are you releasing your product from the cell inside the cells? So if you have a suspension cells and I say it's serum free, it's already easy, but then your product is inside the cells, then you do the chemical lysis, so you explode, all the cell debris is there, so your downstream starts from the pores. But then if we had, for example, iCellis, we have with the same type of approach for the suspension and adherent. And then what one good example from the iCellis is that we also use chemical lysis, but the fixed bed is working as a pre-filter. So the material that comes from the iCellis bioreactor is pretty clean, and then what comes out from the suspension bioreactor is like a porridge. So, but everything affects to the downstream, that what are the changes that upstream.
And so, for example, the ratio of empty particles is not different whether you're using suspension or adherent?
It's for us it's not different, but of course it depends on the product. I think that Lenti is even a good example that we say that it is better produced in adherent because of there's FPS, or is there just better lipids? So probably there could be some differences, but my feeling is that it is so product dependent. Why you need to analyze your product very well.
And you mentioned the sort of antiparticles that are effective. Is there a general rule about what regulators will accept? Bad AAV and whatever?
There is. I cannot say about the AAV and Lenti. I know some what is our ratio. We keep EI for adeno below the 10, but it is also we need to show to the regulatory people that this is good, and then they accept or don't accept.
Different transgenes that are maybe toxic to the helper cells are going to be much lower, but that's still acceptable. You have to go to them with this is the best way to do.
Yeah.
And just the other question, just general costs. So, someone who wants to make an ad or an AAV or anything, is there a general sort of...
I recommend you to go our booth and find our head of business development.
Just so people have an idea.
Yeah, but again, it's a product. Do you have FPS? How large is your process? Do you need to use benzonase? So those can have tens of thousands of differences just the starting point. So everything matters. Yeah, everything matters.
I think I can answer
I can discuss with you the
Okay. Any other questions? All right, if not, thank you very much. I'll close the session.